So tell me what's happened in your life that has brought you in. I see on your paperwork you mentioned dealing with a difficult experience.
Yeah, I don't know how far back to go. Basically, this summer, two of my roommates, or one of my roommates and I went to a friend's lake house and left our other roommate at home because her boyfriend didn't want her to go, and we were fine with that because he's kind of just possessive, bad drunk, and we don't really like him anyway. So we went, and I had to come back early on Sunday, and I came home, and that's when I found Tiffany. She's on the floor bleeding, stabbed to death, and I called 911. They said there's nothing I can do about it. She died, hours ago, and then about an hour later, the cops found my boyfriend John. He bullet to his head, so he used to have the courtesy to shoot himself. We didn't have to go through a trial or anything.
I'm so sorry that happened to you. This must be sad and terrifying for you and your family. Exactly how long ago did this happen?
It was the week before July 4th, so it's right at 6 months.
What types of changes have you noticed in yourself since then, as far as your demeanor, your feelings, sleeping habits?
Yeah, sleeping. I don't do that very well anymore. I try to stay at work as late as I can, stay up late working just so I don't have to have too much time to think about stuff before I fall asleep, because then I'll just dream about it.
How often would you say you've had these dreams in the past month?
I don't know, it's hard to say.
Would you say a few times, once or twice a week, every night?
It's definitely not nightly, but definitely several times a week.
At their worst, how much distress or discomfort do these dreams cause you? Do they wake you up? And if so, what are you feeling or doing when you wake up? And how long does it take you to go back to bed?
Yeah, the worst, I definitely wake up. Sometimes I can fall asleep, sometimes I can't for a couple hours.
Do you have these images day and night, or is it mostly in your dreams?
No, it's during the day too. And these images, just pop in my head during the day, and I try to make them stop. And they're just, stick in your routine, but it doesn't help.
I see. Have you noticed any pattern as to when these thoughts will pop into your head? Are there consistent cues or triggers that you can associate as far as when they occur?
Well, I can't watch Law and Order SVU anymore, if that's what you mean.
Well, it's an example, but I was thinking more on a day-to-day basis. Is it certain noises, certain people's voices, a specific smell, or maybe a certain time of the day or the week?
No, I don't think so. They just pop up. I don't really know what to expect. I wish I knew what to avoid.
That's okay. Not everyone has cued distress. So you're trying to avoid thinking about what happened. Would you describe these thoughts more as recollections or more like flashbacks?
What do you mean?
Is it intense images or thoughts, or are you actually reliving the event as if it were happening again?
Yeah, I'd say I relive that weekend a lot, and just thinking, what I could have done differently. And sometimes, yeah, it just hurts, and I just feel tight all over.
Has this affected your work?
Yeah, my boss was really understanding in the beginning, and gave me some time off and everything, but, within the last 2 months, I'm still not concentrating, and he's actually had to write me up for stuff being late, and he basically just said, he can't keep covering for me, so.
What about your social life? Have there been any changes in interaction with your friends? Do you still have the same hobbies?
Yeah, it could probably be better. I just don't want to be a burden to my friends, and so I guess, no, it's not the same as it was before.
So I'm hearing you have these images playing in your head during the day as well as when you fall asleep. And all the while you're trying to keep up with work and your friends, and that's a lot to deal with. I'm glad you came into my office today.
Yeah, I was kind of hesitant to come in.
Yeah, it can be scary.
Yeah, I'm not always great at talking about my feelings.
No, so far you're doing a really good job. These aren't easy things to talk about at all. From what we've discussed, I think I know what direction we may need to go in. Have you ever heard of PTSD?
Like post-traumatic for the veterans?
Exactly. Would you say what you've experienced is on that level?
It's hard to say. I mean, I've never been shot at or anything, so...
Yeah, well, despite the name, it's not just for veterans. I'd say what you've gone through is pretty traumatic.
Yeah.
Yeah, and PTSD refers to people who are not recovering naturally from all different kinds of trauma.
Yeah, if you say it like that, yeah, that sounds pretty right.
Yeah, I'd like to refer you to a great psychiatrist that can prescribe you some mild antidepressants to help you get back on your feet.
I don't know if I need that. I mean, I'm not sad all the time. I just want to get these thoughts out of my head and tightness out of my chest. So I don't even ever really trust medications.
Well, understandable, and it's completely up to you. I just want to present that option to you. I would like to invite you back so I can help you work through what you've experienced in more detail. And we'll go at your pace, as long as you're willing to talk about that day and that weekend. I can guide you through the process we call exposure therapy. I believe it will help you have more control over your thoughts and lessen the distress of your flashbacks and dreams.
That would be nice.
Great. Well, let's plan on meeting next week. It was very nice meeting you.